Hey everybody, welcome to another Cases and Conversation. So it's been a while since we've done one, and we're excited to be back. It's been a little busy lately.
Yeah, it's been busy.
But we were like, hey, there's good stuff we want to share. And this time you're wanting to share an interesting topic that is impacting a lot of people right now.
We're going to talk about allergies and maybe a little on asthma too.
Right, so the case is on, allergies
and
and
I'm
asthma.
kind of merging a few different cases that I've seen lately. Well, we just got back. That's why we've been kind of on the go.
Yeah, let's get into the conversation. Let's not slam right into the case yet.
Conversation. That's right. We just got back from the British Virgin Islands.
It was nice.
Which was
we did
pretty
a little
amazing.
Little 8-day tour on a 50-foot catamaran. It was a ton of fun.
It was. 4 couples. You were our captain.
Yep. Certified on a big boat. I think the one thing that was interesting for us that ties right into what we're talking about in our cases is that Indiana this time of year, it's challenging for any of us that have allergies or asthma and all that stuff. You get out on the ocean and on the water for 8 days. I had nothing. No allergies, none of that stuff, no asthma. So
I know our eyes were good,
it is definitely at a high at this time of year. And I think it was interesting yesterday because you were pulling up your phone app and it gives you air quality, and it tells you.
This whole weekend or the past, it gave like 3 days here in Indiana. Like we were on high alert for poor air quality.
Right.
So, and it's honestly been like that for months, I feel like. We were at the Indy 500 this past weekend too, and we were outside a lot this weekend, and we were looking at our cars and all the pollen on the cars, and after the race, everybody's like eyes are all irritated, and
Crew Car Wash is loving it.
It is, exactly. You know, part of it is just being in Indiana, right, and being a Hoosier, and we're not going to escape it, but people that don't even suffer allergies, I feel like this year have been calling in and coming in.
Right.
And people that have allergies and are on their allergy medications have been still miserable and saying like, what else can I do? And so that's kind of where I wanted to go with this.
It is interesting on the conversation piece because I've looked at, my wisdom unit now is higher, and it seems like every year I continue to change. Which is why we're excited about what we're doing with OptiLive Medical, because you have said all along is like people need personalized plans because their body continues to change. And so I used to never be impacted by allergies and stuff, and now I mow with a mask on. I mean, right? Yeah. And so these things are real, and the ability to track it as we get wiser. I know you don't like me saying that, as we get older, but I feel like I'm maybe wiser a little bit. So, but I mean, it intrigues me that this body is constantly changing.
Well, and I think people get in where they're like, well, there's nothing else I can do. I have allergies and it is what it is. And I mean, there's a lot of over-the-counter meds and treatment options out there, and we can layer upon them, but it's been fascinating to watch how, allergies are your immune system overreacting to something. And so with time, you become sensitive to it. And part of it is, like I said, in Indiana, like there's so many trees and pollens and things that we are very sensitive to. A lot of people are. And so you add that to maybe their gut or their immune system gets stressed or out of balance, or they have some also food reactivities. So it's usually kind of like a perfect storm where you have a bunch of things going on. And so we may not ever, completely eliminate allergies that are going on, like especially these airborne allergies. But I have a prime example of a kid who has horrible allergies every year. And this year it just like exploded, got really bad, and mom was desperate, and through some testing found some other things through food sensitivities. And these eliminating dairy within a week, this kid could go outside and play. And after a couple of weeks, it was like, oh my gosh, he's not so tired.
And that's so impacting, which is why you're sharing it.
On these, and it's so, I just hope that maybe we'll throw out some little pearls and things that might help people, because what we have right now, we have antihistamines, which it's like Benadryl, Claritin, which is loratadine.
Were you surprised the other day, one of the ones over counter, you said, oh my gosh, people can get that? It was a nasal spray.
Oh, they're starting to get, yeah, one of the nasal sprays that used to only be, I think it's like
Prescription.
Astapro. It's an
Is that a good
allergy
thing or a
nose
bad
spray.
thing?
Yeah, it's good.
Okay.
Because we used to only have nose steroids, like nasal steroids, Flonase or fluticasone,
yeah.
and now they're doing the allergy nose sprays, so that's good. But if you look at those, so histamines get released. It's like a histamine response, and with allergies, and so antihistamines, they block the histamines. But again, it's kind of like way down the road. So you get exposed to something, all these other things get released, leukotrienes and all these chemicals. You don't. It's not important to know all those, but so then they cause the release down here of histamines. So antihistamines kind of work after the allergic reaction and the allergic response has
Already
occurred.
occurred.
So they're kind of like stop the runny nose and some of those symptoms, but like the congestion and all the other stuff really is so chronic and it's there. So we can help the runny nose, the itchy eyes, and some of that with antihistamines. Antihistamines do have dryness. They can cause sedation. And there's something called the Beers list. It's anyone 65 and older, there's this list of medications that they warn you to avoid because they can cause memory trouble, increased risk of dementia, and believe it or not,
Well,
the
I don't need that one.
antihistamines,
You
the
already say I have a
antihistamines
bad
are
memory.
on those. It's getting better. The antihistamines are on that list, and so again, we don't want to. We kind of use them like they're candy, right? Everybody uses them. So people are calling in now. They're on their antihistamines and they're miserable, and they're like, it's still not working. There are some other prescription meds out there. People might have heard of something called Montelukast or Singulair. And that one also, it works
Can
a
you
little
spell that one?
earlier. I can, but it works earlier in this whole cascade, like I said, up here where these leukotrienes and other chemicals get dumped. And they work really good, but it has a black box warning because it can cause mood disturbances, depression, sleep trouble. So none of these meds are without side effects or potential concerns. You've
You know,
got
one thing
nose
I haven't
sprays.
tried is during this time is doing the neti pot
Well,
every day.
that's
Oh, was that one of
interesting.
your ones?
No, but that is interesting.
Why have
Saline.
I not done
You know,
that?
that is a good thought,
I
Eric.
do it when I get a cold,
Yeah.
but to just
There is
do
some
it
data about using
prophylactically.
saline nose sprays or neti pots. You can buy like a nasal
You
mist, or
bought
you can
some of
do
those
a
saline
neti
nasal
pot.
sprays.
And those
But
flush
the neti
out.
pot, think about how that flushes things out.
Yeah.
To your point, there's the initial interaction with something that starts the process, right, of creating the immune system to say, oh, we need to fight this, and maybe with the neti pot keep that from even occurring.
Well, so allergen reduce the exposure is like the best treatment for allergies, right? So if it's really bad, we'll have people like shut the windows. Don't, even though it's beautiful out, sometimes that is something
Right.
you need to do. If you're mowing, wear a mask. The saline and all that like flushes out maybe some of those.
The other one I've seen too is the air filter.
Oh, that's a
You
good
can
one.
get
The
one that
HEPA
has the
filter.
allergy that's a little finer to capture some of those allergies. So to your point, if the house, close the windows, let it be your safe place, make sure that you're still filtering out that which is already there for your safety.
And it does help. I think sometimes allergy tests are helpful because you can figure out like, oh my gosh, it's grass for me, or these certain types of trees, or dogs or cats, or and you can do everything you can because sometimes carpets carry a lot of dander, and if your dog's going out and rolling in the grass or different things, like just trying to sort out what it is. And then the other nose sprays that people use a lot are the steroid nose sprays. But again, steroids, have their own issue, and they can be drying and irritate the nose. So the reason I really wanted this conversation is that as I've been doing this for several years, I've started really looking at like, okay, there got to be some other alternatives that are safer, or things that we can add into the regimen if they're already taking an antihistamine. And it's really neat. There's some good literature out there about some natural substances. One's quercetin. There's butterbur, bromelain. Trying to think if there's any others that I'm missing. Vitamin C, some of the vitamins. And so like D-Hist, Orthomolecular makes a really good allergy medicine, D-Hist. It's a supplement. You can buy it over the counter. It's a really good quality one, and so I've had a lot of people do great with it, just adding it into their regimen this time of year. And then recently we started doing IV infusions because it really started with, again, me looking outside the box, but we had somebody coming in whose asthma was so flared and allergies, and we couldn't get her calmed down. And so looking at the literature, there's really good literature about magnesium for asthma attacks. It relaxes those bronchioles, like the smooth muscle in your airways. And so,
Yeah, whenever I do a Myers, it opens
Isn't
completely,
it
opens up my
amazing?
breathing,
Yeah.
like that.
And there, back in the day, before we even had a lot of our allergy meds, and people went into the hospital, they would get an IV magnesium drip in an asthma attack. So it works great. So
Which the Myers cocktail
and Myers has
infusion
magnesium,
in it.
and it also has Bs, like all the B complex. I think B12, B6. Those both have been shown to. Well, they also lower histamines. Vitamin C is huge at lowering histamines.
Was the NAC, did it have bees in it? Or what was in that it also helped me after my COVID?
NAC it thins mucus, and so it is a supplement you can use. And with allergies, like especially like chronic allergies, people have a lot of mucus production. They have a lot of congestion. So NAC is another. It's NDHIST, so it's a good one.
Oh, it is? Okay.
And then with the IV infusions, so like vitamin C is an antioxidant, lowers inflammation and swelling, all the oxidative stress. And so a lot of times these infusions, they really help your immune system and equip you to just like basically, deal with the allergies, and then also will lower the histamine response.
Well, we are big on quality of life. And right, these allergies and the asthma stuff, it really lowers the quality of life. I mean, I think about mowing the yard without a mask on, and if I don't take something, Benadryl or something afterwards, I'm sleeping the rest of the day.
Well, that's what I was going to say. You come in, you're exhausted.
Just the grass.
And even allergies
Which
get
keeps
everything.
Me from having to mow.
Yeah. So it's good
I
exercise
still
for me.
But Jack does for me.
Our neighbor Jack. Thank you, Jack. But the allergies, if you're always like inflamed and everything, then you can end up being more prone to get a sinus infection, or it stresses out your immune system, right? And then one last thing I thought was interesting, if you look at these, like the Myers infusion especially, it has all those Bs and zinc. When we're stressed, our asthma can flare more and allergies. And so, when we're stressed, we use up those Bs and zinc and stuff. So that is a good way also. It just kind of replenishes your body and those nutrients so that your body's less stressed and you just can deal with the allergies and asthma better. So
should we get into the case?
Well, I kind of told my case along the way. The one was the patient with I do want to summarize the patient with asthma and allergies, just how much that helped, because this patient had been on steroids, inhalers, antihistamines, Singulair, literally was on all of that, and we just couldn't seem to break that cycle of the asthma flare. And we did a Myers infusion, and it was amazing.
How much of it maybe was digestion too? Because you've said so many times, if you're taking something and your digestion's off, you're not absorbing it. Where the infusion bypasses all of that and just gets it into the bloodstream.
It is true. I mean, the
well,
vitamin.
The patient, I wonder if that was maybe part of it too.
Probably. And, vitamin C is so good for, this was a neat study too on, they were doing it for people with allergies, and I think they did acute and chronic allergies, and they had these patients come in and they gave them just high dose vitamin C through the infusion. And then they looked at them with standard care, which was an antihistamine, or adding the vitamin C, and it was like 97% had response, and the vitamin C helped their symptoms, whereas they were not getting relief on their antihistamines. So that's pretty impressive for the acute and chronic.
So we can do, of course, most of our infusions that we do, you're being very objective, says, hey, this is where you're deficient. But like a vitamin C, if you had those symptoms, then you could you could get a bag, we could push the vitamin C in, or whatever was necessary for the patient.
And the Myers has high dose vitamin C with the magnesium and Bs, so it's kind of a nice general, like during your, like suppose you're flaring for Myers cocktail, if you're flaring, your allergies are really, out of control, you could do that, or you could do the vitamin C and glutathione and zinc to if you're like also like dealing with like a cold and your allergies. So there's some really cool things out there that have been nice for us to be able to do. And then the other one was just that young boy, how just addressing some food sensitivities on top of all the allergies really helped him manage his outdoor allergies better. So, you know, think of those things. Think about the elimination diets we've talked about, and or food allergy testing, and then maybe some natural products.
Yeah, no, that's great. I mean, our push is helping to improve the quality of life of our patients and those that they know. A lot of times we'll get referrals from others in for the infusions as well. So if this resonates with you, you know, definitely share it, please. The thumbs up is important, you know, on YouTube, and even subscribing is super, super important. If there were anything here that you like, put it in the notes, shoot us a comment or whatever, and or give us some other cases that maybe you want us to highlight. So we are wishing you guys a wonderful day. Take care.